if you're not using it, you're not practicing that movement or that pattern, it becomes less intuitive in a way.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast. And today we're continuing our series on injuries for climbers. And for this particular series, we have Dr. Michelle Snow, who is a climbing and outdoor enthusiast and the owner of Ascend Chiropractic. So Dr. Snow, welcome back to the show.
Thanks.
In the first episode, we talked about some of the common injuries that climbers experience. And in last episode, we talked about shoulder and upper back injuries that can occur and how you can prevent them. Now, one thing that I want to make clear is that even though we're talking about climbers, because it's Dr. Snow's specialty, a lot of these injuries can actually translate across not only multiple sports, but also just everyday life. And so as we're going and talking about these injuries, we are talking about how they affect climbers and, but at the end of the day, it can affect a number of different people that don't necessarily climb. So today we're going to be discussing hip flexors and low back pain. Hip flexors is an interesting one that some people overlook, and then a lot of people put too much emphasis on it. So, Dr. Snow, can you tell us about your experience with treating hip flexors and how that affects low back?
Of course. So many of us, just from our day-to-day lives, our normal activities, we tend to spend a lot of time sitting, whether it's commuting in a car, airplane travel, at your desk, or even at home relaxing at the end of the day. So in that seated position, your hips are flexed, and it also tightens up those hip flexors, but pulls your low back into a flexed position as well. So a lot of us in our society today have chronically tight hip flexors. There's certain cases where that tightness is related to other underlying issues. We can get more into that in a little bit, but most of the time it's from our sustained postures and our day-to-day activities that we do.
What specific activities can cause our hip flexors to occur that are like an everyday activity?
Sitting is the biggest one.
Okay.
But pretty much anything that brings that hip forward or that knee kind of closer to the chest. So that's the hip flexion type position or movement. And I see it mostly in my patient population when I'm working with climbers. That activity is very forward flexion heavy in a lot of the movements that it does, basically because you're flexing through your hip joint to get your foot higher on the wall to the next hold and propel yourself up the wall in the climb, but also because you're engaging your core and you're trying to keep yourself as close to the wall as possible so gravity doesn't pull you down to the mat.
Yeah, it tends to hurt a little bit when that happens. Yeah.
Yeah, just a little. So in general, when that hip flexor does get tight, it connects from the hip into the low back. So when it gets tight or aggravated, it pulls that low back into an extended position and can kind of jam up the joints a bit. But also it limits the amount of extension that can happen through the actual true hip joint. Okay. So even walking around, we don't think about it that simply, or that it's something we do all the time throughout our day. But when you're walking, your hip joint itself is supposed to extend so that you can push off that foot and propel yourself forward in that motion. But when the hip flexor is tight, the true hip joint isn't able to do that extension, so the low back has to compensate for it. Like we talked about in previous episodes, anytime a part of the body is not moving as it's supposed to, another part of the body adjacent to it has to compensate to create that movement or to complete that activity.
Okay. When we're limited in hip extension, because of what you described, tight hip flexor. I'm assuming there's a pelvis tilt somewhere in there as well. When we have that limited extension, what does that look like as far as what is an individual experiencing when they're having issues with that hip extension? You said that the low back tends to compensate, so I'm assuming that leads to low back pain in that sense. Okay.
The low back joints can get kind of jammed, but also they're moving in ways or more than they are supposed to do because they're compensating for that movement. So the joints itself can get aggravated in the low back, but also the surrounding muscles in the low back because they're being used in ways that they're not quite designed to be used. So they can get inflamed, tight, just aggravated.
Okay. You mentioned with hip flexors, so they tighten as we're in that flex position. So sitting at a desk, driving in a car, sitting on the couch, pretty much what people do like with 80% of their life.
Yep, all day long.
Yeah, so that entire time, this is one of the effects that we're having is, tight hip flexors. I would imagine if one side is tightening, the other side is weakening, right? So we probably have weak glutes as a result of all that as well, of all the sitting that we do.
Yeah, exactly. Because anytime a muscle is not being used or it's in posture consistently being in a stretched or elongated position, it's not being engaged. It's not activating like it's designed to. So that's where you, over time, lead to, like you said, a weakening of that muscle, or even just the signaling from the nervous system, from the brain, to fire those muscles and have them actually engage and activate. It's if you're not using it, you're not practicing that movement or that pattern. So it becomes less intuitive in a way.
Okay. Earlier, I mentioned that there's people that don't look at hip flexors at all, and there's some people that really overemphasize, hip flexor tightness. And so what I meant by that is I've seen like some massage therapists or even, other chiros, acupuncturists, stuff like that they go and constantly work on the hip flexors trying to loosen them. But if they loosen it and they tighten back up, isn't there usually something else going on with that? And can you speak to that a little bit?
Yeah, exactly. So, there could be very different causes of that muscle being tightened. A lot of times in our body, to prevent injury, we have these reflexes, or our body just intuitively will tighten certain areas or restrict certain motions because it senses that you could have a potential injury there, or you've had an injury there in the past and your body remembers that. So it's trying to prevent that from happening again. So in those sort of cases, the muscle might be tightening because there's some sort of underlying issue or instability that's going on, and your body's trying to protect itself from getting injured further. And other times it's just, again, sustained postures over time or certain activities that are aggravating the hip flexor or keeping it in a flex position so it gets tight. So it's could be either or. Yeah. You have to, again,
chicken or the egg.
Yep, exactly.
Scenario. Yeah, for sure.
Some, like you said, some people focus on it not at all, and some too much. So I'm more typically a middle of the road kind of practitioner. You have to take it as a potential factor that's going on. Maybe even try a trial of care that's really targeting that area. And if it's not being effective or being a sustainable relief for that person, then you have to switch directions and figure out maybe it is something different. Maybe you do need more stability in the hip or other exercises regarding the deep stability muscles of the low back. And typically for that, I'll send out to physical therapy, for example, to address those underlying issues.
Okay. Now, when if there's more of an underlying, so hip flexors can lead to back pain, can lead to hip pain, I would imagine as well. Yeah. What are some things that we can do at home or that our listeners can do at home to kind of address this and see if it is somewhat of an issue for them? I would imagine if they get a little bit of relief from whatever symptoms they're experiencing, back pain, hip pain, it's definitely a contributing factor. What are some things that they can do before they jump straight to if it's more complicated and they need to go to a PT or something, or to come to you, obviously, what are some things that they can do before that?
The simplest thing to do at home to try first is stretching out that hip flexor. And I'll describe what I usually teach to my patients that have issues in this area of the body. And it's like your typical quad stretch is how you start. It's something, you've done all your life, learn it in PE class growing up. You hold on to your ankle or your foot and you bring that heel close to your glutes. So that's the general position that you're in. But an important part of that is to make sure that you're engaging your core. Because again, if you're just kind of yanking that leg back, you could be pulling your low back into extension and just exacerbating the issue further. But keeping that core engaged so that your pelvis stays stable or tipped kind of underneath and stays underneath your whole torso, that will keep it in the right positioning to truly target the front of your hip and your hip flexor.
I don't think I knew that was the correct way to stretch that. My PE teacher clearly taught me wrong when I was in school, because I didn't know you had to engage the core and keep your pelvis. I mean, it makes sense now that I think about it. But all this time, I'm like, oh, okay, yeah, well, I guess I'm not a biomechanics specialist at the end of the day, so then that's one of the reasons why. But okay, that's interesting. I did not know that. Yeah,
that's honestly something that I see very commonly, because just as human beings, we're typically pretty competitive people. So whether it's with yourself or the people that are around you, you want to try and bring it the furthest, stretch the furthest, right? And so those are ways that we kind of trick the system to pull further. But
let your back extend.
Exactly.
You can go way further. Yeah.
Yep. Okay. So really honing in, focusing that stretch on the front of your hip by keeping that core engaged. And then the thing that I like to add to it that's different from most people is a technique called PNF. It's something that can be applied to several different stretches and in different parts of the body, but it stands for proprioceptive neuromuscular facilitation, PNF for short, so you don't have to say that mouthful every time.
Yeah.
But the basic concept behind it is that you are activating the muscle that you're trying to stretch for a few seconds and then relaxing it and allowing yourself to stretch even further. So with this example, with the hip flexor stretch, you're in that position like your typical quad stretch. You're keeping that core engaged. And then you're going to kick your foot down into your hand for a few seconds. So you'll feel your quads and your hip flexor activating in the front of your hip and leg. And then you relax those muscles and that activity, and you can pull your heel using your hand up closer to the top of your glutes. And it gives you a better stretch. It's more effective because you're basically playing with the physiology of the body and tricking it in a way to relax even further.
Okay. Yeah, that sounds like a really good stretch too, actually. So you have those two stretches that can go in and address the hip flexor. What are some other things that can be done? Let's say, okay, those don't work. What's the next step that someone can take if they're not loosening up after these stretches? Actually, before we even get to that, how many times should they be doing these stretches? How long?
So switching between a few cycles of that relaxing and stretching within that movement or that stretch is a good thing to do, like in each stretching session per se. So 6 to 10 switches between those two positions.
Okay.
And making it a gradual movement or a gradual stretch is the best thing. It's the most sustainable. It also doesn't aggravate your body. It allows it the time to actually adjust to that movement and that new stretch. So if you can implement that stretch into your day-to-day routine several times throughout the day, so sometimes it's, you connect it to an activity. When I first wake up, I do this stretch so that you have that trigger in your mind and remember. And then maybe I have a 20-minute break for my lunch during the workday. I'm going to do another session of that stretch and then before bed. So I would say 3 to 6 times throughout your day is pretty effective in most cases, but especially before and after any activity that you're doing. So whether you're going to be cycling, do it before kind of as a warm up for those muscles, and then after for sure. And then climbing is one you'll see me pretty often, whether I'm at the gym treating patients or about to climb myself. I'm usually doing that hip flexor stretch to warm up that area and stretch it out.
Okay. How does having this issue affect climbers when, during that? You said a lot of times they're going to have that hip flexor tightness because they're constantly compacted and they're using that as a main force. So I'm assuming they, down the road, they can experience low back pain as a result of that.
Exactly.
Okay.
Yeah. And anytime the low back is further extended, you're just playing with the mechanics of the body and the joints. So you start forming different compensation patterns and just putting pressure on parts of the joints or tension on the muscles that they're not designed to. So it can lead to, acute injuries in some cases if you fall and kind of compact your back in a weird way, but also more commonly, most likely just like a overuse injury.
Okay. And then when, they do these stretches, get some temporary relief, or maybe they don't get any relief at all, at what point is it, okay, when should I come in and, see Dr. Snow, or when should I look at something a little bit more serious than just stretching at home?
I would say 2 parts of that answer. If you have a specific injury that happens, say you're climbing at the gym and something is really aggravated and it starts affecting your ability to maybe walk, you're limping a little bit, or just your ability to put pressure onto that whole leg while you're climbing. That's sort of a more acute example of it. It's a good idea to be pretty immediately assessed for what's really underlying it and going on. But also just, if it's more a gradual thing or a chronic issue that's been going on and you're like, hey, I've been struggling with that. Let me try this stretch. If you're giving it a good try and really implementing it into your routine for a week or a couple weeks and you're not seeing much difference, or you get some relief and it keeps coming back a couple weeks later, it's a good idea to go get assessed and again, find out what's underlying, what's causing that to really come back. Sometimes it can be a simple issue that I fix in my office. Just adding on some specific muscle work, releasing those hip flexors, which is not super comfortable to have done, but it's very effective. I always tell my patients, you're gonna hate me while I'm doing it, but you're gonna like me more after. If you ask any of them, it's probably pretty accurate.
Hip flexors a little sensitive.
It can be tender, but it's a super effective treatment. So even just adding that one piece to the puzzle can be very effective because sometimes you just need that initial release and then to complement it with you going home and gradually and continually doing that stretch to allow that muscle to continue relaxing more. But sometimes it just needs that initial push and release type treatment in my office.
Okay. And then you said, you get good results with that. And then worst case scenario, if they're still having that problem, then that's when you go to PT because there's more of a hip instability issue going on.
Exactly.
Like
yeah. And usually in my office, I like to see people, it's usually on average like 4 to 6 times, honestly.
Yeah.
It's a very short treatment period.
Yeah.
Because if I'm not getting good results or sustainable results with what I'm doing, not seeing any changes, then I'm not going to keep you in my office forever. I want you to get the care that you need so that you can be out in the world doing what you love to do. So, if that's the case, you're not seeing any sort of sustainable result, then I'll send out for different type of care or another assessment, like from a PT, for example, to see if there's something else really going on and causing it.
No, it makes sense. So start with the hips, work your way up from there. And then don't listen to your PE teacher that apparently taught me to do everything wrong the entire time. And if you're a coach or a PE teacher listening, please start engaging your core when you teach these stretches, so you can help people like me who have tight hip flexors down the road because I wasn't taught properly. We threw enough at you all today. In the next episode, we're going to be discussing injuries to the hands and how that can affect climbers. And this is one that I'm really excited for because I don't know much about how to evaluate hands, how to treat them, different things to look for. And this is something that Dr. Snow is amazing at. So looking forward for that piece. Dr. Snow, thank you so much for being on the show again.
Thank you. It was a blast.
And we'll catch you on the next episode. Thanks for listening.